It's a great question. I think over recent years, we've seen a big movement away from people doing a little bit of foot and ankle to, full-time subspecialty foot and ankle. And I think as our knowledge of foot and ankle has evolved, we're seeing that there are greater and greater things to learn, practice, and evaluate when we're seeing these foot and ankle patients. So really, as a foot and ankle, as a subspecialty, has really come on leaps and bounds. And historically, where we were slightly behind other specialties, I think there is so much going on at the moment that I think going forward, full-time foot and ankle, when you look at the volume of work we're doing with trauma, with elective, understanding all the pathologies, certainly, it's only going to get busier and busier for foot and ankle surgeons. So that subspecialty interest is going to be key. And I think, we're seeing more and more trainees realizing that, foot and ankles are really exciting and evolving specialty to be in. So it's something very exciting for the future. Certainly where I work, which is one of the UK's busiest trauma centres, we have really seen that the complexity of the ankle fractures we're getting has got significantly has evolved significantly. And so there's a lot more that we are doing as foot and ankle surgeons. Whereas historically, we used to leave ankle fractures to junior trainees or generalists. Because we're doing so much more when we fix an ankle fracture now, I think that subspecialty training is really important. So I think there may be simple injuries that can be managed by the general trauma surgeons or general orthopedic surgeons, but certainly from the complex injuries, it really needs that subspecialty training and expertise to deal with them appropriately and prevent the complications that we can see happen. And I think that's equally important in elective and the trauma setting as well. We've seen huge developments in the technology associated with foot and ankle, things like using 3D printing to create prostheses, surgical planning using computer technology, and I can only see that that's going to evolve more and more. We've really been testing out using 3D custom cutting guides to help with deformity correction, and so obviously AI is going to play a huge role in not only evaluating patients, but giving us an idea about the best treatment strategies for patients as well. I think we've seen a huge explosion in minimally invasive techniques, and historically that started with the minimally invasive bunions, but you can see in recent years we've extended that to widespread elective procedures. We're doing osteotomies using minimally invasive burrs. We're now doing joint preparation, and that includes a trauma setting. So, minimally invasive surgery has really taken off. I think that going forward, what we will see is the long-term outcomes of minimally invasive surgery, and that's perhaps the one thing that we're lacking at the moment. Early outcomes are comparable, early complication rates look really promising, but what will be really interesting is how things compare in the longer term, 10, 15 years time. So certainly I think that's going to be really important. So education is one of my passions, and I think being able to share knowledge that we've gained is so important. And so, I think that the use of cadaveric labs is really key. So actually, you're not practicing on the first time you do the operation in theatre. You've had the opportunity to do it on a cadaver, understand some of the anatomy, understand the dynamics, and really prepare yourself for the first, second, third times you're doing that in theatre. I think sharing knowledge and talking about how things go wrong can really help people focus on how to avoid those complications. And so, getting together, looking at common complications, talking about cases, really using some practical tools to educate and develop that generation so that they understand and they can prepare themselves for future practice. So I've always been a firm believer, OrthoHouse is clearly passionate about looking after the next generation of surgeons. And I've always been a firm believer that the best way to do that is through education and support. The opportunity to support trainees to travel around and see different perspectives and see different ideas, whether that may be visiting fellowships, whether that may be, going to meet centers of excellence around the world. That's really going to help trainees develop and just see a different perspective to what they're used to in their home country. So I'm a firm believer in, traveling and experiencing different healthcare systems. I think that we talked about the use of cadaveric labs is such a huge opportunity for trainees. And it gives them not only an opportunity to learn about the pathologies, but really get to use the kit and get their hands on and practice these operations before they're actually doing it for the first time. Foot and ankle is a fantastic specialty. It's hugely diverse. We never do the same operation on the same list. So challenging. Our learning and understanding of foot and ankle is still developing. And actually, it's a great community to be involved in. Foot and ankle surgeons are really nice people, really fun people. And so it's an enjoyable place to be.